Hello. My name is Jones, and today we are going to look at the second stage of labor. The second stage of labor begins at full cervical dilatation and ends with a complete birth of the baby. It has approximately 30 to 45 minutes in a prime gravida, and it's important that we note that it should not exceed 1 hour. And it has 15 to 30 minutes in a mount gravida, of which it is important to note that it should not exceed 30 minutes. The second stage of labor is divided into two phases. There is the latent phase and the perineal phase. The perineal phase is also known as the expulsive phase or the active phase. So when we talk of the first stage, which is the first phase, which is the latent phase, it begins from full cervical dilatation to the time that the presenting part is visible at the perineum. Okay, so this is the latent phase, which is the first phase of the second stage of labor. Then the second phase of second stage of labor is perineal phase. So perineal phase begins with the appearance of the presenting part to complete expulsion of the fetus. The mother has a strong urge to push voluntarily during the expulsive or the perineal phase, okay, which we call the active phase. Okay, so now with this discussed, let us now look at the physiology of the second stage of labor. So in looking at the physiology of second stage of labor, we are going to look at 1, contraction and retraction. 2, we'll look at pelvic soft tissue displacement. 3, we are going to look at expulsion of the fetus. So let us look at 1, contraction and retraction. The nature of contraction becomes more expulsive. As pressure is exerted on the rectum and the pelvic floor, the mother feels the urge to push, and the secondary powers, that is abdominal and diaphragmatic powers, come into play as the baby is being pushed down the birth canal. The reflex may be controlled initially, but become increasingly impulsive, overwhelmingly, and they become involuntary. So this is what is happening during the contraction and retraction. Okay, the nature is that the contractions, they become more expulsive during the second stage of labor, and there is more pressure that is exerted on the rectum and the pelvic floor, with the involvement of secondary powers, which is abdominal muscles and the diaphragm. Okay, when you talk of primary powers being involved mostly, or when we talk about primary powers, we mean the uterine muscles being involved. Okay, so on the physiology of second stage of labor, we can also look at pelvic soft tissue displacement. Anteriorly, there is the bladder, which is pushed upwards into the abdomen, resulting in stretching and thinning of urethra. The advancing head directs the vagina and may lacerate the mucosa, causing a slight bleeding. The perineal body is flattened, stretched, and thinned from the triangular 4 by 4 centimeter to a transparent 10 centimeter in length, lengthening the posterior wall of the vagina, causing the vaginal orifice to be directed upwards. Posteriorly, the rectum becomes flattened in the sacral cave, and some fecal matter, which commonly they say the fish twin, okay, some fecal matters may be expelled. The anus pouts and gradually gaps until the opening is 2.5 centimeters in diameter. So under the physiology of second stage of labor, we can also look at the expulsion of the fetus. The head is seen at the vulva, advancing with each contraction and receding between contraction until crowning occurs. The head is then bone by extension. The shoulders and body follow with the next contraction together with the rest of the amniotic fluid. So this is what happens within the physiology of a second stage of labor, which comprises of contraction and retraction, then pelvic soft tissue displacement, of which we have mentioned some items here or some issues that are involved, and then the expulsion of the fetus and what follows. So for now, let us look at signs of a second stage of labor. So when you're looking at the signs of second stage of labor, we have anticipatory or presumptive signs. Okay, so we have anticipatory or presumptive signs. So here in second stage of labor, we have expulsive uterine contraction. It is possible for a woman to feel a strong desire to push before the cervix is fully dilated. Pressure will be exerted on the rectum. Then the other sign, anticipatory or presumptive sign within the second stage of labor, apart from expulsive uterine contraction, is the rupture of forewaters. So there will be rupture of forewaters, there will be pout and the gaping of the anus, and then there's congestion of the vulva, and then the last one also that can be seen is appearance of a presenting part. So when you talk of rupture of forewaters, that is the water in front of the head, this may occur at any time during labor. And then we talk about pout and gaping of the anus. There is a deep engagement of the presenting part, and premature maternal effort may produce this sign of pout and the gaping of the anus. Then congestion of the vulva, enthusiastic premature pushing may also cause this. Okay, so it is important to know when it is necessary to tell the woman to push. So you need to avoid enthusiastic premature pushing when the woman is in labor. Okay, so other anticipatory or presumptive signs of a second stage of labor may include vomiting or hiccup, okay, trickle of blood per vagina, gaping of the vulva, bulging of the perineum. And then we also see the appearance of the presenting part. So these are some of the anticipatory or presumptive signs of second stage of labor. But conclusive or diagnostic signs of the second stage of labor is that it is only on vaginal examination that confirmation of the commencement of the second stage of labor can be made. This is a full dilatation of the cervix, meaning no cervix at all is felt during this vaginal examination. Okay, so this is the conclusive or diagnostic sign of second stage of labor. But otherwise, anticipatory or presumptive is just about expulsive uterine contraction that happens, rupture of forewaters, pout or gaping of the anus, congestion of the vulva, gaping of the vulva, vomiting, hiccup, or appearance of the presenting part. Okay, so now with this discussed, let us now look at management of second stage of labor. So the aims of management of second stage of labor is to ensure a live and safe delivery. Second aim is to prevent complications. Okay, so in management of second stage of labor, we are going to look at preparation of delivery. Then we look at delivery of the head. After the head comes delivery of the shoulders. Then there is immediate care of the newborn. Then afterwards, we'll talk about complications that can occur during a second stage of labor. Okay, so to begin the management of second stage of labor, let us now look at preparation for delivery. So as you are preparing for the delivery, you need to maintain normal room temperature of about 26 degrees Celsius, which is warm enough for the expected visitor or baby. So you have to let the woman empty the bladder or pass a catheter if she is unable to pass urine, to prevent a delay of second stage and third stage, as well as preventing rupturing of the bladder. You can place the woman in the dorsal position or squatting or position of her choice. This is to promote a descent, okay? And also, this also is good for pushing. You can wash your hands, dry them, and also open outer part of the delivery pack. You can put on a mask, sterile gown, gloves, and complete the preparation of the sterile field where the baby will be received. This is to prevent cross-infection. Then your assistant will be responsible for fetal monitoring and maternal well-being, as well as efficiency of the uterine contraction. Your assistant should do the observation every 5 minutes. She should also ensure that the mother maintains a good position and gives clear, helpful instruction. You can stand on the right side of the patient. You can swab the perineum with antiseptic and place one towel under the woman's buttocks and the other one on the abdomen where the baby will be received. Okay, so now with that discussed, let us now look at the delivery of the head. Okay, with that discussed, we can look at the delivery of the head. So in the second active management of second stage of labor, to do with the preparation of the delivery, you can do all this and also ensure that your assistant has something also to do. So now, delivery of the head, you can press a sterile pad over the perineum and anus using the right hand and advise the woman to push with each contraction. You can watch and control the advance of the fetal head in a downward direction using the left hand so that the smallest diameter presents. You can cover the perineum and anus with a sterile pad using the right hand. You can decide whether to perform an episiotomy or not as you note the time at which this stage is taking, because we have established the amount of time that it needs to take. You can avoid performing an episiotomy in patients with the conditions like HIV. This is to reduce the spread of infection to the baby, or the likelihood of spreading the infection to the baby. So the patient should only push when there is a contraction. When the head has cramped, let the woman stop pushing. Instead, she should pant so that the head can be delivered slowly to prevent trauma to the head as well as perineal tears. Okay, the brow, face, and the chin are borne by a movement of extension. You can check to see if the cord is around the neck when the head has crowned. This is to prevent hypoxia to the baby. So you can check for the cord and remove this cord. If it is loose, it can be slipped over the shoulders. If it is tight, then you can apply 2 artery forceps about 3 centimeters apart and hold a swab over the cord and cuts by unwinding. Then you can clean the baby's eyes and clear the baby's airway as the baby is born, or do some resuscitation, okay, to ensure there is adequate oxygen inflow to the brain. Okay, so then we can now talk about delivery of the shoulders. You can allow restitution. Okay, when we say restitution, the baby will turn. Okay, that is the baby turning to take place. Okay, so you can place one hand on each baby's side head and apply gentle downward traction, and the anterior shoulder should slip under the symphysis pubis. Once the anterior shoulder is free, you can carry the baby up towards the mother's abdomen. The posterior shoulder can escape over the perineum, and the rest of the body will be borne by lateral friction. Okay, so this is what you necessarily do during delivery of the shoulders. Okay, so with that discussed, let us now look at the immediate care of the newborn. So you can dry the baby, clamp the cord by applying 2 artery forceps about 3 centimeters apart, and hold the swab over the cord as you cut the umbilical cord. So note the time of birth and assess the APGAR score to ascertain the baby's condition. The parameters of respirations, heart rate, muscle tone, reflex, and color are assessed using the Glasgow Coma scale. So the normal range is necessarily between 7 to 10. You can show the baby to the mother to identify the sex and the general condition. The assistant should give oxytocin 10 international units within 1 minute of delivery. This will help to prevent postpartum hemorrhage. You can place the identity band, and identity band on the baby's list containing information about the mother's name, file number, date, and the time of birth, also with the APGAR score. You can initiate breastfeeding as soon as possible. This is to stimulate the production of oxytocin, which in turn causes contraction of uterine muscles, and also it promotes bonding. Then you can wrap the baby in a towel to prevent heat loss, and avoid procedures which break a baby's skin or mucous membrane, or increase the baby's contact with the mother's blood, such as scalp suctioning, where it can be avoided, and also suctioning may break the mucous membrane. Complications that may occur during a second stage of labor. So during second stage of labor, complications like perineal tears are due to large diameter of the fetal head presenting part can happen. Then there can also be antepartum hemorrhage, either due to placenta previa or a rupture. There can be fetal distress due to malposition, and also because of cord around the neck. There can also be trauma to the fetal head, such as tentorial tears due to cephalopelvic disproportion. There can also be prolonged second stage of labor that may be due to full bladder or any other causes. Okay, so there you have it. Today we have been looking at the second stage of labor. And in looking at second stage of labor, we defined it as a period from full cervical dilatation up to the time the baby is born. Okay, so when you're talking of prime gravida, it is last 30 to 45 minutes. Okay, and it should not exceed an hour. When you're talking about multigravida, it's 15 to 30 minutes and should not exceed 30 minutes. The second stage of labor has 2 phases. Okay, from that cervical full dilatation, we'll call that the latent phase. Okay, remember when we talked about first stage of labor, we talked about active, latent, and then also the transition phase. Okay, so after transition phase comes the latent phase in second stage of labor, then the perineal phase. So the perineal phase is the appearance of the presenting part, at the perineum. Then we went on to look at the physiology of second stage of labor, which includes a contraction and retraction, that is happening within the uterus, and then pelvic soft tissue displacement. So anteriorly we have the bladder, posteriorly we have the rectum, and what is happening within these areas we discussed. Then the expulsion of the fetus. So after that, then we looked at the signs of second stage of labor, of which we said there are anticipatory or presumptive signs, and then there's conclusive or diagnostic sign. When you talk of diagnostic sign, this one is established through vaginal examination. But when we talk of anticipatory or presumptive signs, may include expulsive uterine contraction, rupture of forewaters, a pout or gapping of the anus, congestion of the vulva, sweating and shivering, appearance of presenting parts. So sweating and shivering, this is something that you might notice even in a woman, because the flashing thing is something that can be noticed during this second of labor. Apart from that, there's trickle of blood per vagina, and then there's gapping of the vulva and also bulging over the perineum. Okay, so that has been our lesson on second stage of labor. Please, we have done a lot of lessons to do with labor, first stage, second stage, third stage, and the like. So I'd urge you to also watch some of those lessons that we have recorded, apart from other medical videos that we have recorded. Ensure you subscribe for more content from our channel.